So without further ado, I would like to introduce kind of Jennifer to you. She's going to start kind of sharing her screen, so bear with us a moment while we're doing that. The technology gods haven't been that kind to us this evening, so we're hoping it's all going to go well. But Jennifer is the lead equine vet at Penmellyn Veterinary Group, and she joined in 2016 and enjoys all things medicine and a variety of veterinary work. Outside of work, Jennifer has a small herd of rare breed sheep and Gloucester Old Spot pigs as well, which is quite interesting.
Right, everybody, hopefully this will work. If any of you know me, you may know that technology is not my strong point. So please bear with, but I will try and share this and hopefully it will work. We hope. Good evening, my name's Jenny Fanning and I am the lead equine vet at Penmellyn Vets over in St Colin. This evening, I'd like to welcome you to my talk, which is going to be talking about looking after our old friends and the care of the geriatric equine. Good evening, my name's Jenny Fanning and I am the lead equine vet. The areas I will be covering are this evening I'd like to welcome you to my talk.
Don't panic, Jenny. It's the technology demons.
Oh my God, I'm so sorry, everybody. I will endeavour to make this work. Let's try again.
So if you just make sure that the kind of previous sessions kind of closed on your presentation and then open it kind of up from the beginning.
Now it's not sharing, even though I think it is. So. Let's try it again.
Looks promising.
Good. Good evening, my name's Jenny Fanning and I am the lead equine vet at Penmellyn Vets over in St Colin. This evening I'd like to welcome you to my talk, which is going to be talking about looking after our old friends and the care of the geriatric equine. So this evening the areas I will be covering are how old actually is old, the normal ageing changes, nutrition and care, common health problems, exercise and retirement, and then a little at the end on euthanasia. Many people are quite rightly unsure what classes as geriatric, and I'm sure many of you would be surprised on how often what we still think of as young horses and ponies are actually classed as geriatrics. As you can see, the average life expectancy of a horse is somewhere in the region of 20 to 25 years, a pony 25 to 30 years, and donkeys 30 to 35 years. And obviously we know there are many out there that are much older than this. As to the clarification of veteran horses, for insurance purposes, this is usually classed as more than 15 to 17 years old. In the showing world, it's more than 15 years old. And on the pre-purchase examination, an aged horse is more than 15 years old, which is previously more than 12 years old. So we would therefore class 15 years and older as geriatrics, and this is the age that we would suggest you should be starting to take that little extra care of your old friends and knowing what you should be looking out for. To illustrate this point, research has shown that 20 to 30% of UK horses are in the geriatric age group. Many of these horses are still working and competing well into their 20s and even into their 30s. However, more than 95% of these geriatrics will have at least one health problem, and diseases in these geriatrics will limit both their working life and their total lifespan. Unfortunately, it's been shown that many of these problems can be easily missed by owners. Not through negligence or by not caring, but just because the signs can be very subtle and often mistaken for the normal aging process. This slide illustrates some of the normal signs of equine aging. Muscle and body fat is lost due to their increased breakdown and disuse. These changes can be seen in the top picture of the Palomino. This is rather an extreme example, but it gives a good illustration of the changes I'm describing. You can see his sunken back and a loss of his top line, the prominent bones of his hindquarters, and if you're able to look closely, you would see the atrophy of the masseter or cheek muscles on the face. In older equines, their hair coat often becomes grey with poorer hair and skin condition. They will often have weaker immune systems, and Cushing's can play a role in this. The bottom picture is of a pony showing one of the latest stage symptoms of Cushing's, the curly coat. Eye changes can be seen, such as cataract shown in the middle picture, and some older equines will exhibit hearing loss and even senility. In this slide, I've listed some common geriatric health problems, some of which can be mistaken for the normal signs of aging. First on the list is obesity. And although not often mistaken as an aging sign, it is now, more than ever, very common in horses and is very much a problem of domestication. Then, more commonly associated with aging, we have weight loss, dental disease, Cushing's syndrome, otherwise known as PPID, joint disease, liver disease, colic, and heart murmurs. Over the next few slides, we'll be looking at each of these problems in a little more detail. Monitoring body weight is often a lot harder to do than you would expect. Visual condition scoring is very objective, and everyone has different ideas of what's correct. You could look at their girths and rugs getting tighter, and this is an indicator, but can't always be relied upon. Weight tapes are also not always that accurate. It depends exactly where you do your measurement and what time of day. For example, bellies will be bigger in the evening when they've had a full day of grazing. The tape also doesn't take into account a cresty neck, or as I like to call it, the McDonald's M bottom. However, if you use the tape at a consistent place on the horse at a consistent time of day, it can be useful to monitor for any gains and losses. The most effective way of monitoring weight is a weigh bridge, and you're able to make an appointment with one of the equine nurses here at Penmellyn to use ours as needed. Another great way of monitoring weight is also to take monthly photos from all angles. However, please beware, being slightly overweight is worse for health than being slightly underweight. Now we will discuss each of the common geriatric health problems in more detail, starting with the most common, dental disease. More than 95% of geriatric equines will have evidence of dental disease on oral examination. Dental disease is a common cause of secondary problems such as choke, impaction colic, nasal discharge and weight loss. It can also be an important reason for non-emergency euthanasia due to loss of body condition and pain. Understanding the development and aging of teeth helps explain the types of diseases and the reasons they occur. Now we will discuss each of the common geriatric health problems. This diagram of the equine skull demonstrates the position of the equine cheek teeth or molars. More than 95% of geriatric equines will have evidence of dental disease on oral examination. Around 4.5 to 5 dental disease is a common cause of secondary problems. Most of that length is concealed below the gum line. Nasal discharge and on an oral examination. It can also be an important reason for non-emergency euthanasia. They give the impression that their body condition and pain. But by 4 to 5 years old, their teeth are as long as they are going to get.
Explain the
and as they age, their teeth actually erupt through the gum line.
Strange going on there. You've got a couple.
Eventually, if the horse becomes old enough, they will run out of tooth.
Sorry, everyone. What it's doing again. Let's try again. Right. Let's review down there.
You should be able to then do it from the current slide rather than the beginning if you get to your current slide.
Yeah, let's try and get that one. I think this was the one we wanted, wasn't it?
Yeah.
Right. Take 500.
This diagram of the equine skull demonstrates the position of the equine cheek teeth or molars within the maxillary and the mandibular bones. A young adult horse has teeth that are around 4.5 to 5 inches long, but as you can see from the diagram, most of that length is concealed below the gum line, and all we can see on an oral examination is the crown of the tooth. As the horses age, they give the impression that their teeth continue to grow, but by 4 to 5 years old, their teeth are as long as they are going to get, and as they age, their teeth actually erupt through the gum line. Therefore, eventually, if the horse becomes old enough, they will run out of tooth. This occurs in both the molars and the incisors. Here we have a schematic diagram of some common incisor problems that we encounter in horses. This slide shows the real-life versions of those schematic diagrams. These are all quite severe examples, but they illustrate each abnormality well. Although these can cause problems in themselves, such as losing the ability to get food into the mouth, they also point to problems further back in the mouth with the molars, leading to problems chewing. For example, the slant mouth, the third picture from the left, is a sign that the horse is only chewing in one direction. Next, I will talk about dental overgrowth of the cheek teeth or molars. The two pictures on the left show overgrowths of the front upper molars. These most frequently occur in parrot-mouthed horses where the lower jaw is shorter than the upper jaw. Therefore, the upper and lower arcades of molars do not oppose each other correctly. This then leads to the upper front and lower back molars overgrowing, which can be seen in the photos on the left and the middle photo respectively. In the picture on the near right, you can see that the outside of the upper molars and the inside of the lower molars are very sharp. It is common for overgrowth to occur here as the horse's lower jaw is slightly narrower than the upper jaw. It is these overgrowths that will restrict the side-to-side movement of a horse's jaw as it is trying to chew its roughage. This picture also shows the cheek ulceration that these sharp overgrowths can cause. This ulceration can be extremely painful and causes horses to drop food and throw their head when ridden, as even when gentle pressure is applied to the rein, the bit acts to pull the cheeks against the teeth along these painful ulcerated areas. On the lower molars, these ulcerations are often seen on the outside of the tongue. The far right picture is the same horse a few weeks later. You can see that the teeth have been rasped and the ulceration has already healed. These pictures show examples of displaced teeth. On the left, the cheek tooth is displaced towards the tongue, and on the right, it's displaced towards the cheek. Again, these can cause ulceration of associated soft tissues and overgrowth of the opposing teeth, which also leads to problems chewing. Caries are essentially rotten holes in the teeth. They occur most frequently in the upper molars, which have two small funnel-shaped openings called infundibulae. These can enlarge and pack food, which then ferments and erodes the surrounding cementum and enamel. We grade caries from 0, which is normal, up to 4, which is the most severe, where the tooth is often fractured due to the damage. Lower grade caries can be flushed and monitored, but if they continue to deteriorate, then they may need to be filled. Diastomata are another very painful dental condition commonly seen in older horses. A diastema is basically a gap between the teeth which can be caused by abnormal eruption, fractured or loose teeth. It also occurs more frequently in older horses because as the teeth erupt, the root is narrower than the crown, causing a gap between the teeth at the gum line. A large diastema is usually not too much of a problem as food passes through them, but the teeth do still need regular dental checks, as the teeth in the opposite arcade can often overgrow and cause problems. Small diastomata are much more of a problem. These pack with food which cannot escape. This food then ferments and rots and causes gum damage, leading to pain, bleeding and infection. This can be incredibly smelly and is known to be one of the most painful conditions that horses suffer from. If diastomata continue unattended, they can eventually lead to loss of the affected teeth. The main treatment is to widen the diastema with a special burr under sedation, which then stops food packing. This picture shows a slab fracture of a molar tooth in the upper arcade. The treatment is removal of the entire tooth. If left in place, eventually infection would enter the pulp cavity and would lead to a tooth root abscess. Periodontal disease is thought to be one of the most painful conditions that our geriatric horses and ponies suffer from, and can be a consequence of any of the dental problems we've reviewed so far, but most frequently secondary to diastomata. Prevention is far better and easier than treatment, and it highlights why it is important to have your horses or ponies' teeth checked every 6 to 12 months. Checks can be performed by either a vet or your EDT, but only vets are qualified to diagnose and then treat periodontal disease. As you may recall from one of the earlier slides, horses' teeth do not continue to grow for their whole life, but have a finite length and continuously erupt. Eventually, the tooth erupts to a point where there is no tooth left below the gum, and the teeth are left with a reduced and poor grinding surface, or the tooth will fall out completely. This can start to occur anywhere from about 20 years old, but this is a problem which is being seen more and more frequently as horses are living longer and effectively outliving their teeth. The main problem with this condition is that the horse loses the ability to chew their fibre, which can lead to weight loss and occasionally choke or impaction colics. Feeding appropriately is very important in these horses, and there will be a slide on this later in the show. Next, we will talk about a condition that I'm sure most of you will have heard of, and I'm sure many of you have a horse or pony with this problem. Cushing's syndrome, or PPID, is a dysfunction of the horse's pituitary gland. It is not a tumour, as in dogs and people, but a true age-related neurodegenerative disorder. Until fairly recently, it has always been believed that this is a condition of very old horses, but recent research has shown that there is a strong correlation with PPID and many laminitics over the age of 10 and certainly over the age of 15, so even our young geriatrics can be affected. Degeneration of nerve cells in the hypothalamus leads to an inadequate production of the neurotransmitter dopamine. This results in the overproduction of hormones produced by the pituitary, which cause the clinical signs what we will discuss further in the next slide. The hairy coat is probably the sign that everybody is most familiar with, but actually this only usually occurs in the latter stages of the disease, and this is why we've traditionally associated Cushing's with very old horses and ponies. Therefore, just because a horse or pony does not have the hairy coat does not mean that they don't have Cushing's. Other signs can include laminitis, loss of muscle mass and poor body condition, fatty deposits above the eyes and a patchy body fat, lethargy, recurrent infections, excessive thirst and urination, and as we've already said, that thick, curly, abnormal shedding of the hair coat. However, not all horses will have all of these signs and can have a combination of a few or just one. Diagnosis of PPID is usually relatively straightforward. Clinical signs can be very suggestive, but then not all of our equine friends read the textbooks. Ideally, a one-off blood sample is taken for ACTH, which is one of the hormones overproduced by the enlarged pituitary gland.
Sorry, everyone, it appears to have decided to stop again, so I will try and restart it. I'm really sorry that this keeps happening. Oh. Just bear with me a moment. My computer has obviously decided it doesn't really want to work this evening.
Good evening.
Oh, sorry, did it again.
Diagnosis of PPID is usually relatively straightforward. Clinical signs can be very suggestive, but then not all of our equine friends read the textbooks. Ideally, a one-off blood sample is taken for ACTH, which is one of the hormones overproduced by the enlarged pituitary gland. This can be used to diagnose PPID, but also monitor therapy. Recent research has shown that horses or ponies with a high ACTH are 5 times more likely to develop laminitis than horses with an ACTH in the normal range. Occasionally, the ACTH comes back normal in a horse or pony that we can still strongly suspect as PPID, and there are further tests that can be done to check this. Treatment for PPID causes an improvement in clinical signs and reduces the risk of laminitis and recurrent infections. PPID can be quite an insidious condition, with owners often not noticing the slow and subtle changes in their equine friend. However, I have lost count of the number of times I've been told after a few months of treatment that they have their new horse. You can see the change in this pony on the left. In March, he was presented for a curly coat, lethargy and recurrent laminitis. After 6 months of monitored therapy, this was him, laminitis free and back to work as a lead rein pony. The next condition that we will discuss is joint disease. This is very common and often affects multiple joints. It can be influenced by weight, the breed or type of the horse, what discipline they compete under, and the intensity of their exercise. It may be due to wear and tear or specific injury. Degenerative joint disease, where the cartilage surface is damaged, may lead to osteoarthritis, where the underlying bone begins to degenerate. This is a basic schematic of joint disease. On the left is a normal joint with a clear joint space and even cartilage to the diseased joint on the right. To begin with, the cartilage of the joint becomes rough and thins, often due to wear and tear. And as this happens, the underlying bone then becomes eroded and starts to degenerate. Previously, the bone was protected by this cartilage, but as this disappears, the bone starts to rub on bone and this can become very painful. As inflammation continues, it starts to affect the nearby soft tissue structures, leading to a thickened synovial membrane and capsule, which makes the joint appear swollen. Inflammation also makes joint fluid less lubricating. This is a basic schematic. The first and most common sign associated on the left is a normal joint lameness, with a clear joint space and even cartilage.
Hi, sorry again, everyone. I'm not quite sure what's happening. I will attempt again.
This is a basic schematic of joint disease. On the left is a normal joint with a clear joint space and even cartilage to the diseased joint on the right. To begin with, the cartilage of the joint becomes rough and thins, often due to wear and tear, and as this happens, the underlying bone then becomes eroded and starts to degenerate. Previously, the bone was protected by this cartilage, but as this disappears, the bone starts to rub on bone and this can become very painful. As inflammation continues, it starts to affect the nearby soft tissue structures, leading to a thickened synovial membrane and capsule, which makes the joint appear swollen. Inflammation also makes joint fluid less lubricating. The first and most common sign associated with joint disease is lameness, which can vary from a mild general stiffness seen when the horse is first walked out of the stable or at the beginning of exercise, to moderate pain, where the horse may start to have difficulty rising, so is reluctant to lie down as they know it's hard to get back up, and problems lifting their legs, which is quite often noticed by the farrier. In severe pain, movement is restricted, and this is often bilateral. Over the next few slides, we'll have a look at the joints commonly affected by joint disease. On the right is an X-ray of a normal coffin joint, which is the joint between the last two bones of the foot. You can see the joint surface is smooth, with no sharp edges, and the joint space is wide and even. In the X-ray on the left, the joint is narrowed, and you can see the bony proliferations or roughenings. This is severe osteoarthritis of the coffin joint. These X-rays highlight the pastern joint, which is the one up from the coffin joint. The normal is on the right, with severe OA on the left with large bony spurs. There is also OA of the coffin joint in this X-ray. In these X-rays, we see the normal knee or carpus on the left, whereas on the right there is narrowing of the joint space, bony spurs and roughening. The Hock X-ray on the left is normal, but on the right you can see that the front of the bones are quite roughened, there are a few bony spurs, and that the bones have a reduced density. Diagnosis of joint disease starts with a clinical exam and lameness workup. Once the lameness has been localised to a leg or legs, then nerve and/or joint blocks can be performed to try and localise the lameness to a specific area or joint. If this can be done, then the next step is to X-ray the area. In certain conditions, ultrasound can also be a useful diagnostic tool. Occasionally, further diagnostic investigations are needed. These include nuclear scintigraphy or bone scan, MRI, CT, or surgical arthroscopy, where a camera is inserted directly into the joint to visualise the inside. Management involves rest or controlled exercise as appropriate. Your vet can help by giving you a gentle exercise programme to reintroduce when your horse is more comfortable, as gentle exercise will benefit the horse in making the joints work more effectively. However, in some more advanced cases, retirement may be more appropriate. We recommend physiotherapy and corrective farrier where required, especially where foot balance is poor. Management involves rest or controlled exercise as appropriate. There are various different
Your vet can
medical
help by
treatments
giving
for
you a
joint disease
gentle
in the horse.
exercise
From
programme
the
to
target
reintroduce when your horse is more
joints
comfortable.
with intra-articular
Gentle
medication.
exercise will benefit.
I'm so sorry, everyone, that this just appears to be doing exactly what it wishes this evening. I'll try again.
There are various different medical treatments for joint disease in the horse, from the target of specific joints with intra-articular medication with steroids or hyaluronic acid, to systemic medications such as non-steroidal anti-inflammatories, as in butagran, equipamazone or danolone, paracetamol, Equine, cartrophen, or drugs such as 𝗙𝗲𝗁 and 𝗙𝗲𝗿𝗄. Discussion with your vet will help you decide which is the best treatment for your horse or pony. Nutraceuticals can be very beneficial as they provide the raw materials to help the body maintain and repair joint surfaces. They can slow the progression of osteoarthritis and they help maintain mobility. They may contain chondroitin sulfate, glucosamine, hyaluronic acid, MSM, to name but a few. Unfortunately, many over-the-counter products are not subject to the same regulations as medicines and may not have been tested for such things such as effectiveness, bioavailability, concentration and source. For example, many of them do not have any research behind them, and although they may say they contain chondroitin or glucosamine, they do not have to state what percentage the product contains and often does not contain enough to be of any benefit. Again, discussion with your vet will help to tailor a plan specific to yours and your horse's needs. Surgical treatments are quite specialist and not always appropriate and are only offered on a case-by-case basis. Arthroscopy involves making small incisions over the joint and inserting a camera in one hole and long-handed instruments in the other. It is keyhole surgery that can be used to remove damaged cartilage, scrape away diseased bones, and in certain cases fuse appropriate joints such as a small joint of the hop or the fetlock. Fusion of joints can only be done in small, low motion joints and so would not be suitable for the higher range joints such as knees or stifles. We must take care, however, in case selection for these treatments, as older horses are a higher risk for general anaesthetics and also have much longer recovery times. Before surgery is undertaken, it is also important to remember the horse's other medical conditions and think if the surgery is going to be beneficial enough to put the horse through with the other problems that it also has ongoing. So far, we have talked about the most common diseases of our geriatrics, and for the rest of the talk, I will give a brief overview of some of the less common but equally concerning problems we encounter. Firstly, liver disease. This is still fairly common in elderly horses and is often not detected until it is too late to do anything about it, as clinical signs usually only occur very late in the disease process. The most common cause of liver disease we see is chronic toxicity, usually being exposed to very small amounts of ragwort over an extended period of time, either out in the field or through hay or haylage. However, exposure to this ragwort leading to liver disease can have been years previously. Liver disease causes depression, jaundice, weight loss, inappetence, neurological signs and photosensitivity. Although these clinical signs often do not appear until a large part of the liver, usually over 70%, is already diseased and lost. Diagnosis is initially made on blood samples looking for elevated liver-specific enzymes, and these can rise even before clinical signs are seen. The particular type of liver disease, information on prognosis, is then made by ultrasound and biopsy of the liver. Unfortunately, prognosis is often poor, but some treatments can be attempted, such as intravenous fluids, steroids, antibiotics, and dietary management. Skin tumours are also very common in older horses. Melanomas, seen here in the top picture, usually but not exclusively affect grey horses. A lot of melanomas are visualised externally, but it is important to remember that they are also spread internally and can cause problems such as colic, neurological or respiratory signs depending on the organs affected. The next most common are sarcoids. These are skin tumours, seen here in the middle photo, that do not spread internally but can be locally invasive and can spread over large parts of the body if left unattended. After sarcoids comes squamous cell carcinomas. The bottom picture shows a squamous cell carcinoma on the end of a stallion's penis. Very rarely they can spread internally, but more commonly they are locally invasive and can virtually destroy the area it affects. Another common site for squamous cell carcinoma is around the eye, especially in unpigmented horses, and the third eyelid. Diagnosis of skin tumours is made on clinical exam and biopsy where it is appropriate to do so. There are a range of treatment options available, but they are dependent on the size and location of the tumour, the type of tumour, and quite often patient and owner factors also. However, the most important thing to remember is successful treatment depends on early intervention. Colic is common in all ages, but especially geriatrics. It ranges from simple medical colics, such as spasmodic, and impactions which are common in geriatrics due to dental disease and reduced mobility, to the more serious surgical colics. Deciding to take a geriatric horse for colic surgery must be carefully considered. They are a higher risk for general anaesthetics, their healing is impaired, and often it will not be covered on a geriatric insurance policy. We can try and prevent some colics from occurring with good management, such as introducing new diets gradually, feeding wet, sloppy food and short chop roughage if dental disease is present, and undergoing routine dental treatments and worming. However, the most important factor in treating colic is time. If you're at all worried your horse may have colic, please call your vet ASAP. It is also important to remember that sometimes, no matter how good your husbandry and how well cared for your horse or pony is, some colics are absolutely not preventable, and nothing you could have done will have caused or prevented it. Heart murmurs are often a consequence of the normal ageing process, as thickening and stiffening of the heart valves leads to turbulent blood flow. We pick up and monitor heart murmurs by listening to the heart at routine visits such as vaccinations. Often no action is needed other than to be aware that a murmur is present and what it sounds like so it can be monitored for progression. Murmurs themselves are not that concerning, especially if the rate and rhythm of the heart is normal and there are no signs of failure. Worrying signs are those of weight loss or exercise intolerance, and your vet can advise if written exercise is appropriate. ECG and ultrasound can be useful to give information and monitor progression. Vital to caring for the geriatric equine is good husbandry, including feeding, regular farriery, an appropriate deworming programme, vaccinations for flu and tetanus, routine dental checks, and any treatment as necessary. Grooming and skin care, training and social contact, and exercise are also very important factors. I'm not going to discuss feeding in much detail, as this will be covered in Tracey's talk later. But when looking at nutrition of the older horse, we need to decide if we are feeding to achieve weight gain or weight loss. Does the horse have any dental disease, which it may affect what food they can eat? And do they have any underlying disease processes such as EMS, PPID, or liver disease? When feeding the underweight horse, offering small, frequent meals can be beneficial, but avoid overfacing them with lots of different feeds and buckets all at once. Ensure access to ad-lib, good quality fibre. Choose a suitable senior mixed feed or conditioning feed, which this can be discussed with your vet and feed supplier. Some additives can also be used to improve the palatability, such as garlic, fruit and veg, molasses, or my favourite, peppermint tea. More commonly though, we need to deal with feeding the overweight horse. As we all know, weight reduction requires feed reduction. To lose weight, horses and ponies need to be fed 1.5% of their ideal body weight over a 24-hour period. This includes both their hay, haylage and their hard feed. When we really need them to lose weight, we also keep them off grass, as this is uncontrolled calories. Unfortunately, we sometimes do have to be cruel to be kind, and there are times when the animal may be without food. This is far less concerning than you may think though, especially as the starvation period is overnight, as horses and ponies naturally don't eat for several hours between midnight and 6 AM in the wild. To achieve weight loss, the diet should be based on good quality forage rather than concentrate feeds, but it is important to keep them on a good quality balancer to get all their vitamins and minerals. Remember to weigh all feeds, including hay, and hay should be weighed at its dry weight and then soaked if necessary. The use of double, triple netting or trickle nets can also be used to prolong the feeding time. As mentioned earlier, we are now seeing much older horses that suffer from senile dental disease. The aim to feed these horses is a palatable diet that is easily picked up and chewed, is good quality soft, chopped, processed high fibre, is high in slow release, non-heating energy, balanced in vitamins and minerals, and easily digested. It needs to provide calories, fibre for gut bacteria and fullness, and avoid packing and diastomata. And it needs to be as close as possible to their natural diet. Speak to your vet and they can supply you with a hay nut in a bucket diet sheet. This only substitutes fibre in the diet, not concentrate feed. Routine healthcare that we recommend for geriatrics includes vaccinations. Tetanus is essential as it lives in soil and gets into small nicks and cuts, and we strongly advise to vaccinate for flu as the susceptibility to flu increases with age. We recommend attendance by the farrier for regular trimming and balancing. Some growth may be slower with age or may be faster due to laminitis, and some older horses will still require shoeing for support. A good deworming plan is also vital. Fecal egg count should be done every 3 months during the grazing season, which runs from March to September in the UK, and blood or saliva testing can be done for exposure to tape and redworm. The results of these tests allows directed worming treatment to avoid resistance to the limited number of wormers that we have available. Also important is your pasture management, such as poo picking, rotation and resting of paddocks, and co-grazing with sheep. Regular grooming is essential for hygiene and inspecting the skin and coat for illness, injury or parasites. The pictures on the right show a pony suffering from a lice infestation and the lice themselves which are visible to the naked eye. Grooming also helps to maintain skin and coat quality and aids and improves circulation and muscling. Hoof hygiene is also important as older horses are more susceptible to thrush, canker, seedy toe and foot abscesses. You should perform daily cleaning of the muzzle, around eyes and under the tail, and in some, sheath cleaning is necessary, but not all of them. If you are undertaking sheath cleaning, you should only use very gentle soap or just warm water, and you can check for abnormal growths or erosions, and if you are unsure, you can always ask your vet for sedation. Regular grooming is essential for hygiene. Exercise is another important area to the management of illness, injury or parasites. The pictures on the right show a pony.
Sorry, everyone, we're very nearly there. Won't be much longer, and then we will be done, and you don't have to see my talk go wrong all the time. Not much longer.
Exercise is another important area to the management of older horses. They are often, but not always, better schooled and more experienced. Exercise helps maintain muscle tone and bulk, joint motion and bone, tendon, hoof horn density and strength. They can be ideal mounts for children due to children's lower body weight, and they can be experienced and forgiving for the novice riders. But we must remember that an unstable novice rider is harder for the horse to carry. Fitness and workload needs to be tailored to the individual, but even gentle exercise is beneficial to keep joints supple and the mind active. We must remember that cardiovascular and respiratory function declines with age, so the horses may not be able to keep up with exercise that they have done previously. Many competitive horses may enjoy a second career in a lower intensity discipline. If sound enough, they benefit from regular exercise. To tailor the work to the horse's ability, make sure they have a generous warm-up and cool-down, and vary the type of work to avoid boredom. Your vet can always help you evaluate fitness, soundness and muscle mass. Fitness and workload needs to be tailored to the individual. Horses have a life gentle exercise.
There are only 3 slides left, I promise.
Horses have a lifelong ability to learn, so training and social contact is just as important in geriatrics as it is in younger horses. They can often change owners several times during their life periods and may need to change their discipline according to their owner's needs and ability. Horses do often enjoy routine and working alongside other horses. If they can no longer compete, perhaps take them to a show as a travelling companion, and when hacking out, they can be used as a nanny horse for a younger animal. Old horses are often retired and replaced, but we must remember that they enjoy security and equine companionship. However, as Fergus is illustrating to us in the cartoon on the left, they can be outcompeted or bullied by some field mates. Lastly, I'd like to talk a little about the difficult and emotive subject of euthanasia. We all hope that our horse or pony will live forever, but eventually they will succumb to something, and it is best to have some preparation for when that day comes. It is very important to understand that very few horses or ponies will die naturally without some degree of suffering. Depending on the circumstances, euthanasia can be done in an emergency or urgent situation, or can be a more considered decision. The most important factor when considering euthanasia is the quality of life. Horses and ponies need to be able to express normal behaviour, be mobile and comfortable, and free from pain and distressing medical problems. Often it is useful to keep a diary to log the good and the bad days, and then look back at this over a few weeks, as it can aid difficult decision making. Euthanasia can be done by lethal injection or by shooting. Either method, when performed correctly, is humane and will not cause any pain or suffering, and is often down to personal choice. Shooting can be kinder to anxious, needle-shy horses, and in some occasions, lethal injection may be the only option available in an emergency situation, as many vets no longer have firearms licenses. If or when you are considering euthanasia, your vet is always there to advise and to talk to. We will give you all your options and together decide what is best for everyone. We don't mind how often you need to call us to discuss this. We are all horse lovers and understand how hard it can be. Your relationship with your horse is unique, and grief for them is completely normal, especially as some of them will have been in our lives for many, many years. Thank you all for listening, and I hope the talk has been interesting, you've enjoyed it, and you've learnt something this evening. If you have any questions, I will be available at the end to answer them. And please always remember that your vets are there to help and always happy to chat if you have any questions, concerns, or if you ever need advice. Thank you again.
Thank you so much.
Thank you so much, everyone, for persevering and sticking with me on that. And I will hand over to, I'm sure, a much more professional talk from Katie. Thanks, everyone.
Thank you so much, Jenny, for persevering with that. It is scary kind of working on all of these new pieces of technology that sometimes don't want to kind of actually work with you. So my talk is going to be on feeding the veteran, and just whilst I am getting myself sorted, I'll tell you a bit about me. So I'm Tracey Hammond. I've been with Dengie as an equine nutritionist for kind of around 15 years now. And this evening we're going to talk through feeding the veteran, which Jenny has obviously already covered some fantastic points there. You will see that feeding the veteran, it's a huge kind of subject potentially, so I am going to narrow things down a little bit as well. So one of the first questions that I tend to get is actually, when do I need to use a senior or veteran feed? Jenny really nicely covered that kind of comment about 15 plus is kind of considered old, but from a feeding perspective, it actually depends on the health of your individual horse. So early research circa 1980s actually found that there was apparent reduced digestion of things like fibre, protein and phosphorus. Studies or similar studies that were then conducted at a later date didn't actually find the same thing, so they didn't find a difference, which was quite confusing. So what was actually going on in those early studies? Well, the researchers suggested that there could have been a couple of factors. So firstly, those early studies in the 1980s that found the reduced digestion could have actually been due to worm burden or previous worm burden and worm damage, because those horses wouldn't have had such a degree of worm management through their lifetime as a horse would these days. Also in those studies, they didn't make any record of the horse's kind of dental condition. So there could have been dental factors having a role to play. So the message that we give horse owners these days when it comes to when do I actually need to choose a senior or veteran feed, if you have a horse that is simply aged and old, but doesn't actually have any health issues, then you probably don't specifically need a senior or veteran feed. You can simply choose a feed that's most suitable for your horse's body condition and their current workload. Having said that, there are obviously those individuals that do kind of age, and they aren't just any old horse, but they are your old horse, and you absolutely know them best and will know the subtle changes that may mean a more specialised diet is required. So that little pony in the picture there, that's actually my pony, 𝗙𝗲𝗄. She's around 31 years old at least, we think, and she certainly fits this kind of latter category of having a number of things that are wrong with her. So generally we'd class her as kind of geriatric in terms of her nutritional needs, and she needs something a little bit more specific. And I will talk to you a little bit more about her as we go along, I'm afraid. I'll bore you with a bit more information about her. So nutritional tips for the healthy veteran. Again, I'm actually going to reiterate what Jenny said here. It's one of the first things I'm going to really encourage you to do is to actually monitor your horse's fat cover, because obesity is a problem and it's becoming an increasing problem in the equine population as a whole, and that can then result in more problems for our older horses and ponies. Not only does it put a greater degree of stress on their joints that may obviously already be sore, but also there is a little bit of evidence to suggest that with old age, horses may become less insulin sensitive. So there may be some insulin dysregulation going on. And unfortunately, that can increase the risk of things like laminitis as well. So obesity is definitely a problem. You should ideally use a fat score chart regularly. Obviously, knowing your horse's weight is important, but using a fat score chart actually tells you, well, how much weight are they carrying? Are they too fat or are they too thin? So it allows you to monitor them and pick up on changes perhaps a little bit more quickly than if you didn't use this process. And it's very much a hands-on process. So what you're looking to do is to feel across the horse's body and basically see how much fat is covering the skeleton. On this particular scale here, this 0 to 5 scale, we're looking for kind of a moderate condition score. And around that kind of moderate condition score, we might be able to easily feel the ribs, for example, but they won't be kind of overly visible. As Jenny said, though, kind of being a little bit lean kind of isn't necessarily a problem, and actually certainly coming out of the winter would perhaps have them on that leaner end of the scale so that they can afford to gain a little bit of weight in the summer months. The other thing for the kind of healthy horse is actually providing a balanced ration. What you can see on your screen here is an example of what a diet that would provide that's purely grass-based at this time of year for a pony that's out at grass 24/7. So they're living out all of the time. The things I want you to particularly look at is there's something called lysine, which is an essential amino acid, and that's one of our building blocks for protein that's really important. That's lacking in pasture at this time of year. But also a number of our trace minerals as well. So things like copper, zinc and selenium, for example, would all typically be lacking in our UK pastures, and that would be all year round. That's not just the winter months. Now, a number of these are what we would call antioxidants, and they have important roles to play kind of in the immune system. So keeping a really good kind of balanced ration in the old horse is really important as well. Unfortunately, as Jenny's already covered, there are lots of common kind of veteran issues that do require more kind of specialised feeding advice. And I'm not going to cover all of them. I am just going to cover PPID and dental issues with a bit of weight loss as well. But one of the points that I would just like to pick up on is if you have an older horse or pony, it doesn't have to be a thin older horse or pony. often there is another health issue going on. So if you come to me for feeding advice and you say, I've got an old individual, they're really not maintaining weight, what do I need to feed? The first thing I'm going to do is point you back in the direction of your vet to try and actually ascertain if there's something else going on underneath, because most older horses and ponies that are healthy can maintain their weight perfectly well, because after all, if they're retired and not exercising, then on the whole their energy requirements are less. So why particularly PPID and dental issues? They are both worrying health issues in the older horse. And out of all of those conditions, they do require the biggest kind of dietary adjustment, and they can be quite scary for horse owners to deal with. So they're the two things that I particularly wanted to cover. Not only that, but we keep some records on the Dengie feed line of why people are contacting us. And over the last 10 years, we've actually seen a 2-fold increase in inquiries relating to PPID and a 2.5-fold increase in inquiries regarding poor dentition. So we know that as our older horses and ponies living longer, we're actually seeing more of these issues and people need more help with their management. So starting off with PPID kind of signs and management, we have a kind of a visual representation there of a pony that certainly looks like it has that issue. And again, Jenny went through a lot of the things that you would see. The 3 things that I'm going to pick up on are in bold. They're the weight loss, the loss of muscle, and laminitis as well, because they are the ones that worry us particularly. So PPID and kind of laminitis risk. Now, one thing that is quite interesting is not all individuals that have PPID will have laminitis, but certainly some of them are more prone to it, and it's probably if they've got underlying insulin dysregulation as well. So maybe they've had equine metabolic syndrome earlier on in their life, or they just have insulin dysregulation now. Also, not all of those that get laminitis will be overweight. There will be a fairly large population of those with PPID that are underweight and get laminitis, which again can be quite tricky to manage. So how do we manage these kind of 2 opposite ends of the scale? So we've got Kizzy there in her fat days before I took care of her, and in the bottom picture we've got Bella, who you'll meet later on. The 2 main pieces of advice for both of these individuals that both have PPID and both are prone to laminitis will be to maintain them at a healthy weight. So for Bella, that would be to increase her body weight, and for Kizzy at that stage, it would have been to lose her body weight. And also we need to manage their intake of something called M.Sc. Now that's an abbreviation for an analytical term, and it stands for non-structural carbohydrate. It's the sum of your water-soluble carbohydrates, which is simple sugars and your fructan added together, plus starch. So for horses that are kind of laminitis prone and have PPID, we do particularly need to manage their intake of sugar and starch. So how do we go about maintaining a healthy weight and managing M.Sc intake? Because this could be an entire kind of hour's topic in its own right, I thought, again, I would just use Kizzy as a handy example, as she's mine, and I'm not going to be offending anybody when I talk about her. So how did we go from Kizzy in her kind of very overweight laminitis stage at 320 kilos to a more healthy 260 kilos. Now, I appreciate you can see some rib in that picture, and she is lean, but that was the back end of winter. And given she's so thrifty in the summer months and puts on weight without any particularly large changes in her diet, I need a bit of wiggle room at that time of year. So I don't mind her coming out of winter looking a bit more lean. It's more appropriate for her, and it helps me to keep her sound because she is very laminitis prone. So for her, the things we did to get her on that journey and get her to that kind of stage, we're not going to talk about bucket feed first and foremost. I am going to talk more about kind of grazing and forage, because they are undoubtedly the biggest source of both calories or energy and non-structural carbohydrates as well. So once Kizzy was sound and over kind of her laminitis episodes and with the veterinary advice, we were able to start turnout again. You can see that the grass that she has access to on the farm that I keep her on is very good, so it needs a lot of management. She's in a kind of a livery yard where I don't have particular control over her paddocks or the size of the paddock or whether I can strip graze or anything like that. So for us, a practical option was a grazing muzzle, which she accepted very well. There are obviously other options that you could use, so things like strip grazing, you know, doing the strips around the edge of the paddock, so to keep them moving a little bit more. Things like that are all really helpful, but the practical situation that we were in, this was our option. Unfortunately for us, kind of over a period of time, it became apparent that Kizzy was very efficient with her grazing muzzle, even in a short period of time. And actually, unfortunately, it's come to the stage now, you know, given she is about 31, her metabolism is definitely not kind of behaving itself. And so we took the decision some time ago to have to actually remove Kizzy from grazing altogether in order to keep her sound. So she now has a big kind of wood chip paddock, which she's got some buddies in, and I do things to try and keep her occupied. So we're now obviously relying much more on our forage intake to meet Kizzy's requirements rather than just grass alone. And certainly from a weight management perspective, as Jenny said, sometimes a period without grass is going to be the best way you can get weight under control, but hopefully for most horses and ponies, they will return to some grazing at some stage, but that's not the case for Kizzy these days. The other thing that we do with Kizzy, the forage on the farm, we obviously tested it. And for Kizzy, she has the kind of more mature hay, and it's tested so that we know that it's an appropriate level of kind of sugar and starch for her needs. So the general guidance when it comes to that is less than 10 to 12% on a dry matter basis. The other thing I did to get Kizzy down to a healthy weight is very much kind of monitor the amount of forage that she has. So even now I weigh kind of all of her hay nets so that I know precisely what I'm giving her. She was initially kind of on 1.5% of her body weight, and there were times certainly when we even mixed straw in it as a lower calorie kind of forage option. But where we're at now at the moment with her, I'm more at kind of 2% of the body weight. She can have a bit more and she's doing well, but I do absolutely still weigh it, pop it in hay nets, definitely use kind of small hold hay nets at various stages, and she's even got one of those forage balls that you can see there kind of in her paddock. As an extra kind of insurance policy for her, I do also soak her kind of forage as well. And when it comes to kind of soaking forage, there's lots of different kind of conflicting kind of information out there about water temperatures and how long you should soak it for. There's basically been lots of different studies which haven't all been looking at the same thing. The general message is the warmer the water, the greater the losses, and with the longer the soak as well. So warmer water and longer soak time will actually result in greater losses of water-soluble carbohydrates or sugars from your hay. Unfortunately, it's no guarantee in its own right that you'd make a high sugar hay safe, but it certainly is a little bit of an extra insurance policy, and it's something that many of us kind of commonly put into practice. We do need to kind of think about hygiene as well. So at this time of year, I do a longer soak because the water's colder. So I might soak morning for night, for example. But in the summer, when the conditions are really hot, I tend to only do so for kind of 3 hours tops, really, because it gets a bit stinky and much less palatable kind of at that stage. The other thing, as an aside from feeding, but again, it's something that Jenny was talking about, is exercise. So Kizzy is obviously far too small for me to ride. And unfortunately, she's a bit of a cheeky character as well. So although she was in her lifetime a riding school pony, she's decided that she's definitely had enough of that, and she doesn't require anybody to really ride her any longer, and she'd like to be quite naughty. So all I do with her now, and I use the word kind of exercise quite loosely, is I kind of walk her in hand, basically like a dog. So I'm lucky enough to be on a farm where we have lots of tracks that we can walk on kind of quite safely. And so I exercise her kind of under those circumstances. And sometimes she's better behaved than others. There has actually been a little bit of suggestion that kind of from an exercise perspective, to help improve kind of insulin sensitivity, we do need quite a bit of kind of trotting within a half an hour kind of exercise regime. So I think it was something like kind of 5 minutes warm up, 15 minutes trotting, 5 minutes kind of cool down. However, she's obviously really old and crotchety. And when I told Kizzy about this whole trotting situation, she was having none of it. She said, I'm quite happy and I'm capable of doing our kind of little walking. So Obviously, again, this is where you need to have that relationship with your vet, because they will in part also tell you what is suitable for your horse or pony to do exercise wise. Kizzy does have arthritis problems and things like that, so lots of trotting wouldn't necessarily do her any favours, but she's quite happy kind of walking and quite content. So when it comes to bucket feed, for those like Kizzy that are kind of really good doers, or you're looking to actually shift some weight from them in order to maintain them at a healthy weight, well, fundamentally all we're going to be doing in the bucket feed is a fibre and a balancer or a vitamin and mineral supplement. It's really all that's needed. We're just looking to top up on those nutrients that commonly lack in our forages and grazing. So it doesn't need to be kind of anything more complicated than that, and we certainly need to keep it low calorie. But what about the opposite end of the spectrum? What about the 𝗙𝗲𝗃s of the world that don't kind of maintain their weight kind of easily? We still need to be thinking about all of those things that I discussed in relation to Kizzy about managing their intake of sugars and starches, but how do we do it in a way that's going to provide them with lots of calories? And this is where we need to think about our more kind of digestible sources of fibre, because for those that do have PPID and are laminitis prone, it makes many of the kind of normal conditioning mixes and cubes much less appropriate for them. So we need to stick with fibre and oil as our energy sources where we can. And not all fibre kind of is the same. So fibre and how useful it is to a horse like Bella, who's much leaner and needed to gain weight, is very much dependent on its digestibility. And types of fibre that are more digestible are things like unmolashed sugar beet, for example, things like alfalfa, even things like soya hulls. There's lots of different fibrous ingredients that are all useful, all very digestible, that the older horse can get much more from. We can also do things like add oil for extra calories as well. So that is another useful way of getting a really concentrated source of calories into those that need help to gain their weight. The other thing that we said about PPID was actually the loss of muscle condition as well. Now, a lot of these horses will be in a kind of negative energy balance, which means that they break down their muscle because they need that protein from the point of view of actually energy. So the first thing that we need to do for those individuals is get them back up to a good weight again. So having sufficient energy in the diet is one of the first things that we need to do in order to maintain kind of our muscle condition. We also need good quality protein. So in particular, things like lysine. So lysine is one of our essential amino acids, and it's a building block of protein, and it's a limiting one. If we don't have enough lysine, then we can't actually synthesize some of the others either. So you saw in that chart earlier on that in the winter diet, for example, at grass, then lysine kind of was low. Unfortunately, when it comes to actually building kind of muscle, it's really exercise that's going to do that. So we may actually have to adjust our expectations, particularly of the older horses that may have musculoskeletal issues, because they simply may not be able to exercise in a way that's actually going to rebuild that muscle again and getting them looking like they used to. It's probably an age-associated change. Now, lysine as a source of good quality protein comes from lots of different sources in the diet. So alfalfa that goes into our feeds, for example, supplies 7 grams per kilo of lysine compared to 5 grams per kilo in hay. So it would be considered a good source. Very commonly though, you could simply utilize a feed balancer to supply lysine. So the difference between a feed balancer and a vitamin and mineral supplement is, on the whole, your vitamin and mineral powder supplements will tend to supply your vitamins and minerals without appreciable levels of lysine. With feed balancers, they supply much higher levels of your lysine, so they give the good quality protein plus your vitamins and minerals. So for your older horses and ponies, where we perhaps don't know the quality of the forage or the grass that they are on, utilising something like a feed balancer can easily meet kind of their requirements to make sure they are getting kind of what they need to help maintaining their muscle mass. This is Ella. I actually met Ella's owner on a kind of an evening much like this in conjunction with a vet practice, and it was actually in Cornwall in the days when we could see people. And she actually came up to me at the end of the talk to discuss the problems that she was having with Ella. And Ella was a 15 to 16-year-old horse at that time, and she'd actually lost lots of weight and muscle actually before the winter, so in the autumn months. So Ella's owner was obviously really concerned, and she had spoken to her vet, who had done a routine blood test which had identified PPID. So as you can see with Ella there, she hasn't got any of the kind of curly coat signs or anything like that. She had simply lost weight and lost muscle, and she didn't have laminitis either. So for her, it was the weight loss and the muscle loss that was the key indicator of the PPID. So having spoken to me, I suggested a ration of the Dengie Healthy Tummy and the 𝗙𝗲𝗿𝗶𝗁 kind of mixed together to provide Ella with a balanced diet, some high calories and some good quality protein, and all things considered. And Ella's owner phoned me again, kind of post the winter, and said, "Oh, I think we might have gone a bit too far now. Do I need to change anything? Can I send you a picture?" So she sent me a picture, and yes, I would certainly agree. Ella has regained her condition and needs to stop kind of gaining that condition now. We don't want her to become overweight. So we made some dietary adjustments, and Ella carried on kind of happily and healthy after that period of time. And really that just goes to show that kind of this monitoring, constant monitoring of these individuals is really important, because you may have to make tweaks and adjustments. It's not that you've just got them on one diet and that's it. You might need to make some changes at different times of the year. One of the common issues that we have with those with PPID is fussiness, and it's a question that, again, I get time and time again on the feed line, and sometimes we do have to compromise. So it's probably better to provide them with something that they will eat rather than not eating something at all, especially if they are lean. So if we have to use something that's a little bit less appropriate, because perhaps it's got a bit more molasses in it, or perhaps it's got some cereals in it, then if we can largely make the diet appropriate, but with some of these exceptions, then sometimes that's what we actually have to do. But for the fussy feeders, where we can, things that we try, including offering kind of multiple fibre types to see if they have a preference. So that can be a net of hay, a net of haylage, a bucket of chopped fibre, for example, give them a choice. We also tend to advise offering feeds cafeteria style. So this would be splitting out your usual kind of feeds that you've normally fed without an issue into separate buckets and seeing if there is a preference. If your horse suddenly doesn't like the beet or the chopped fibre, for example, then that gives us some information that we can work on and try something else. And it is worth trying both chopped and soaked fibre sources as well. It's just seeing if there is something different. Obviously, Jenny gave that kind of peppermint reference. That is very useful indeed. You can try flavourings and things like that too. So moving on, poor dentition, kind of help. My horse can't chew hay or haylage. What do I do? So this is a big deal because, quite frankly, it's really easy for us to pop a net of hay kind of in the stable, and we go into a bit of a panic when suddenly our elderly individuals are unable to eat it anymore. And Dengie funded a study, it was a number of years ago now, and it was carried out by a Writtle College student to investigate just how big an impact poor dentition has on older horses. And what they found, or what they did, sorry, was that horses with poor and normal dentition were actually compared, and their ability to consume 3 different types of forage within a 45-minute time frame was looked at. The types of forage that they used were either hay, a short chop high temperature dried grass and alfalfa product, which was Dengie 𝗙𝗲𝗄 senior, and a soaked alfalfa sugar beet combination, which was Dengie kind of 𝗙𝗲𝗄𝗏, so 2 together. And what they found was that hay was refused on 44% of occasions by horses with compromised dentition. So in other words, if their teeth weren't good or their mouths were painful, they would simply ignore the food. They wouldn't even try to kind of eat it. The short chop high temperature dried grass and alfalfa blend was refused on 6% of the occasions. So there were still some individuals where even that short chop was difficult for them to manage. The soaked alfalfa and sugar beet combination wasn't refused at all. So the main point here is if we can provide fibre in a form that these old horses can manage to chew, they will still have the desire to eat, basically, and will eat it quite happily. So why do we need to make sure an appropriate alternative to forage is found and fed at an appropriate quantity? Well, dental issues like smooth grinding surfaces, wobbly or missing teeth, and gum and jaw issues can lead to a number of things. So fundamentally, it's a failure to grind fibre into smaller particles, which then increases our risk of choke, increases our risk of colic, and can also result in weight loss as well. So there's lots of consequences of not being able to chew fibre as the horse should. So if you're at that stage, my horse can't chew forage, kind of what's next? What can we do? Well, if it's appropriate, if you don't have any kind of laminitis issues and you have the grass available, then the simplest option would actually be to turn the horse out 24/7 to grass, because often they can manage grazing much more easily. It's much easier for them to chew. That is, however, worth keeping an eye on, because there certainly have been paddocks that I've been around with older horses and ponies where you can see that they've quidded out lots of wads of grass, even though they look like they're doing kind of okay. If you're not able to turn out to grass kind of all the time and the horse or pony has to be stabled, then another option that we have is to actually utilise things like short chop fibre feeds, because these tend to be easier to chew than long stem forage because some of the work has already been done. As Jenny said, if the horse has got a diastomata and is prone to getting things packed in the teeth, you might bypass that stage and moved on to the third stage for a soaked fibre ration altogether. So you might just do an entire kind of fibrous slop that requires no chewing whatsoever, so that older horse can really easily manage to eat it. So what feeds are hay replacers? Well, they're those that are fibre-based. So we're looking for feeds that are at least 20% fibre or more. They're going to be low starch feeds. Hay does not contain a lot of starch, and we have to watch the amount of starch that goes into the horse's digestive system to keep the digestive system healthy. For laminitis-prone individuals, we're also going to need to watch the sugar content as well. And finally, the other thing about hay replacer is they've got to be those feeds that can be fed in very large amounts. So for example, there might be some feeds that contain vitamins and minerals as a complete feed that you cannot feed as a total kind of hay replacer. You have to be guided by what the product says. So Dengie have a number of hay replacers in our range, and I'm certainly not going to talk through all of these for you, but just signpost you to the fact that on the Dengie website, which is dengie.com, there is a whole section about hay replacers and the different products that we have. We have some products that can be total hay replacers, like these ones on the screen. So fundamentally, that means they can be fed ad lib to totally replace the forage ration. And then we have other hay replacers like these, which are partial hay replacers. And the reason that they're partial is that there might be some kind of nutrients or ingredient in there that limits the amount that can be used. So for example, with the meadow grass with herbs and oil, it's the high oil level that's actually limiting the amount that we can use in the horse's diet. One confusing thing about hay replacers is, how much to feed. We're often told as horse owners to keep our meal sizes small. Now, that is kind of important, especially if you're feeding cereal-based concentrates. But when we come to the stage of a hay replacer, because this is fibre-based, it is much more appropriate once it's been gradually introduced to the horse's ration for it to be left in larger amounts. Now, in terms of how much to feed, ad lib if possible, and I say if possible because, again, there will be those individuals that may have been kind of underweight. You get them on an appropriate hay replacer ration and then they potentially become overweight. So it's all about kind of weight management. On the whole, these hay replacers will replace hay on a weight for weight basis. So if you weigh how much hay you would usually give, you can simply gradually replace that hay with the same amount of hay replacer. Just bear in mind though that if your horse has had dental problems, their hay intake may have decreased over a period of time. So if they are needing to gain weight, again, I would say feed more than that and offer kind of ad lib. If you tend to feed haylage, then you tend to require about 1.5 times less by weight of hay or hay replacer compared to haylage. And when I'm talking about weights and things like that, of things like hay replacers, it is all on a kind of a dry basis before you add any water to it, just to be clear. One of the things I'd encourage everybody to do that's having to utilise a hay replacer is absolutely to weigh everything, because it's so important to know that your horse is eating enough, or if you have to manage their weight, that you keep that at a controlled level. And there can be some huge kind of variations in scoop weights. So we're all naughty as horse owners. We like to use a scoop, but even, for example, within the Dengie range, a stub scoop can hold between 300 to 500 grams of our chopped fibre feed. So a scoop isn't just a scoop, it depends what goes in it. When it comes to how to feed hay replacers, then we're going to be feeding them in a bucket kind of rather than a net. Unfortunately, the hay replacers don't go in a hay net. And one tip that I would give is if you can get some really large kind of wide bottomed buckets, then it helps to stop the horse taking such big mouthfuls kind of all at once, can keep them occupied for a bit longer. Or you could even put it on some rubber matting, for example, if it doesn't mean that all your food's going to be wasted and mushed into the mud. If you are feeding outside, do put some rubber matting underneath, just from the point of view that these hay replacer rations, especially if they are soaked, will be messy. You need to be prepared for the fact that you are going to be coated in lots of slop kind of on a daily basis when your horse gives you some affection. One thing that we don't want to do is to soak hay replacers kind of too far in advance if you are using a soaked product. In really kind of warm weather, these products can ferment, so at the very least they won't taste very nice to your horse and is likely to put them off. So try and soak small amounts ahead of the time that you're actually feeding, so not too far in advance. With hay replacers, although they are fine to leave in large amounts as an alternative to a hay net, if you can split up the quantity through the daytime, then that's fantastic, because unfortunately these will be eaten that much quicker than hay in a hay net, and there's just no way of getting around that other than dividing our hay replacer up into small meals where we can. We do give tips like putting a football on top of the bucket, for example, or even some really, really large smooth pebbles that you can get from the garden centre, popping those in the bucket so the horse has to lick kind of around them in order to get their hay replacer ration. But fundamentally, the best thing you can do is to divide that daily amount up into smaller portions. So I just wanted to talk a little bit about Bella kind of quickly before we get to your questions. So Bella is the underweight PPID, laminitis prone individual. She's thoroughbred, she's an ex-high goal polo pony, and unfortunately through Bella's lifetime, as you can see from the picture of her teeth there, her front teeth are very worn down. She was actually a cribber for a long period of time. So Bella always tended to manage much better when the grass was longer rather than when the grass was shorter. When that picture was taken at the bottom, which as you can see was around Christmas time, Bella had dropped a lot of weight and kind of muscle mass and had suddenly stopped eating a lot of her forage as well. And poor Bella, lo and behold, there was a couple of things that were affecting her. She was diagnosed with PPID. She did have a laminitis bout, but not only that, her teeth had given up on her as well. Now, as it always happens, kind of on the yard, you get lots of people making suggestions, and lots of people have made suggestions to Bella's owners, everything from feed boiled barley to use a conditioning mix or cube. Now, that would have been really inappropriate for Bella because she did have laminitis. So having high starch feeds like that in large amounts wouldn't have been suitable. But not only that, you know, none of those things, you know, a conditioning feed at the full quantity can actually make up for the deficit of what the horse isn't getting from a forage ration if it can't chew it. So luckily Bella's owner was sensible and asked me for some advice as a nutritionist, which I gave, and we got Bella started on a hay replacer product. And over the winter months, she went from 382 kilos to 425 kilos. So she gained 43 kilos over the winter. And I think you'll agree, she looks much better in that photo than she did. And that was purely from changing her hay replacer, or changing onto a hay replacer ration, I should say. She didn't have any conditioning feeds that were high in starch or anything like that. We simply sorted the fibre out for something that she could manage. You can see she still, you know, lost a lot of muscle mass at the top there, but generally her weight is much better. Unfortunately, Bella's not with us anymore, but she did, you know, end her days much better, in much better condition. So if you've got an older horse or pony, kind of what can we do to help? Everybody here has various parts of experience with older horses and ponies. And not only that, we're qualified to give you some advice on the most suitable types of products for your older horses and ponies as well. And we obviously know kind of our products. So if you have been sitting there thinking, oh, I wonder, or I'd like to know this, then please do get in contact with us. If you have a look on the Dengie website, which is dengie.com, click on the contact us section and you'll see that little bit there that gives you a link to our feed advice form, where you can provide all of the details about your individual older horses and ponies, and we can give you some advice. So although I've given lots of generic kind of information here, as I said, it's not just any old horse, it's your old horse, and we need to know a bit more about your old horse in order to give you the best possible advice that we can. So let me stop sharing. That's me done for the evening. Are you okay to come back on, Jenny, and we'll answer some questions?
I'll try. There we go.
Right. Let's have a look. Just looking through the questions. So there's somebody asking about kind of turmeric for joint support. Do you have any opinions on that, Jenny?
I do, and they're not generally appreciated by all of the equine community, I would have to say. I think turmeric is something that will be a really big thing in the future as an anti-inflammatory in horses. Unfortunately, at the moment, a lot of the studies that are done are in humans and not in horses. And it's not the turmeric itself which is the anti-inflammatory, it is the active ingredient, which is called curcumin. And just feeding turmeric does not feed enough of this active ingredient to actually be of much benefit. You end up having to feed kilos and kilos of it a day to actually be of benefit. There are a few products that have managed to get that curcumin down, get that out of the turmeric, get it into a concentrated enough dose and a bioavailable dose, because that is the other thing. We know in humans it has to be fed with fats, and I know plenty of people feed it with black pepper. Again, there's not a lot of research behind this. This is more people just trying things out. So as I said, there's these few products, but just feeding turmeric itself probably is not that beneficial, and I'd probably save your money for elsewhere.
Yeah, okay. And probably just in terms of other things that I'd add to that is it's so important with all of these things never to forget other things that we can do. So if keeping that horse moving, keeping it at a healthy weight, are all extra things that can be supportive for joints, aren't they, as well, and are just as important, and you know you can do those yourself too.
Yeah,
excellent. Oh, so somebody else is asking about choke. Kind of what do we recommend with choke? What's the kind of problem and things like that?
From a medical point of view, if it's a horse that's got that just chokes the once, then usually it's because they've eaten their food too quickly, or they have eaten something too big, like we do see them choke on carrots, on Swedes, that sort of thing, or turnips, sorry, in Cornwall. And if it's that, we usually say give them half an hour, as long as they don't have breathing difficulties, and most horses will clear it by themselves. If they're not clearing it or they have breathing difficulties, then we will come out and see them. If it is a recurrent choke, main thing to do is that they really need to have their teeth checked. And if they find no problem with their teeth, then looking at dietary management, and they do have teeth problem, addressing those teeth problem, and then going on to something like one of the more easily chewed diets as well.
Yeah, definitely. And from a nutrition perspective, it's, you know, if it's reoccurring, then we would say go onto a soaked ration kind of fundamentally, rather than anything else. I mean, in terms of you know, what we say about chopped fibre is that, you know, it's in amongst mixes and cubes and things, it does help to slow the rate of intake. So for just generally greedy feeders, sometimes adding a chopped fibre can help slow them down and is useful. But certainly if they're choking because they've got any dental issues or reoccurrent issues with choke, then definitely a soaked mash ration is the safest way to go. Just a question here for me, I think. So a lady has retired a 26-year-old thoroughbred due to soundness issues. He's currently fed on Dengie 𝗙𝗲𝗄 oil with top spec comprehensive balancer. His weight is great. If I say a little overweight, would you suggest changing this to the senior one? So from the Dengie perspective of that one, it kind of depends on how much the 𝗙𝗲𝗄𝗃 oil is forming of the ration. So from the fibre feeds that we do, 𝗙𝗲𝗄𝗃 oil is our highest calorie kind of fibre feed. So it would be much more suited to kind of poor doers or those that struggle to maintain their weight. So if your oldie is doing really well weight-wise and you're feeding any significant amounts of that, we probably would drop it down to a hi-fi product instead, and that could indeed be hi-fi senior, which would be lower calorie, but it would still supply, you know, some good quality protein kind of with the alfalfa in there as well. And balancer wise, the comprehensive is fine. You know, you just need a balancer that's going to provide a balance of nutrition. What's there? Should you feed stallions any different? Is an interesting one there. What's the effects of age on fertility in stallions, Jenny?
So some stallions do lose fertility with age. They don't tend to lose their libido, but their sperm count gets lower, their sperm gets slower. And to be honest, feeding wise, that's probably not my area of expertise on feeding stallions for fertility. I don't think there's anything you probably can do. But general feeding is down to what your stallion does. He is just as prone as other horses to putting on weight. If he's a top competition stallion, then you have to feed him differently to a stallion that's just stood in the field covering the occasional mare. So I think you can't really cover stallions in general. It's down to the individual.
Yeah, and absolutely, it's down to the individual, and you know, many of them tend to be good doers. So again, the general advice would be kind of a balancer, and if you're looking to keep them calm, then try and stick with your fibres and oils for your slow release energy sources and things like that. There's probably another question on here for me. Somebody said that their 20-year-old is quite stressy, and that they use senior, but they're concerned that it's got a high sugar content. Would they be better on hi-fi molasses free? So with hi-fi senior, because it contains grasses, it is more sugary than the hi-fi molasses free. But just to put that in context, the overall kind of sugar level comes out very comparable to your hay. And obviously it's all in context of how much you feed as well. If it's only kind of a very small amount that you're feeding rather than very large amounts, or even if it was, I wouldn't expect it to really influence your old boy's behaviour. By all means, if the teeth are good and he's quite a good doer, you could use the hi-fi molasses free, but I don't think it's going to make a huge difference compared to the senior. And again, these old ones are just as prone to you know, being kind of stressy for other reasons as well. So changes in companions, things like that, yard activity that would be worth looking at as well. So I'm just scrolling through the questions. Oh, there's a question about sweet itch. You mentioned mud fever earlier, Jenny, but could you do a bit on mud fever, sweet itch, and anything kind of you'd recommend for those?
Yeah, just looking at the question there. So for sweet itch, unfortunately, that's a a really difficult condition to try and manage. Dietary wise, it is everything you can do to try and keep their skin as healthy as possible. So making sure they have a really well balanced diet. The sweet itch is an allergic reaction to midge saliva. So there is nothing you can really feed them to try and stop that allergic reaction, but it's keeping that skin as healthy as possible. So even when they have that allergic reaction, it's to try and keep up their skin immunity. So somebody has mentioned brewer's yeast, and yes, certainly in many of the products that you get that you would feed for sweet itch, there are things like thiamines, bromines, vitamin B, brewer's yeast, your Marmite type derivatives basically. So from a feeding point of view, that's your main thing. Otherwise, it is midge avoidance, and it is your rugs, your lotions and potions, keeping them in during midge time. So that's in your more dusk and dawn is the main midgy times. And sometimes we have to say you have to move your horse. So moving in Cornwall, we're quite lucky. We've got lots of coastal areas. So yeah, it is midge avoidance, and it's probably one of the most difficult conditions that we have to deal with as vets and owners. Did you say, was somebody asking about mud fever as well?
Wasn't, but I just thought I'd pick up on that as a skin element as well.
So again, feeding is just basically making sure they've got the very best diet that you can possibly, again, for skin health. The main way to manage mud fever is that a horse needs to come in and have dry legs for at least some time in a 24-hour period. It's not necessarily mud that causes mud fever. It is continued wetting of the legs, which causes little tiny cuts and openings in the skin, and then bacteria gets in there. That's what causes the mud fever. They can get as muddy as you like, but if they come in, they dry off, and you brush the mud off, and you get nice dry skin, then you will be able to manage it. Try to avoid things like scrubbing legs, certainly scrubbing legs with Hibby scrub, because that is quite irritant. It can be used in very, very, very dilute amounts and then rinsed off if you must wash them. But generally, I'd recommend coming in, dry their legs, let the mud dry naturally, and just brush it off. If you have to wash them, make sure you dry them thoroughly afterwards. And I would certainly suggest, if your horse will tolerate it, a hairdryer on a really cool low setting, just to get them as dry as possible.
Yeah, excellent. So we have got a question about COPD here. So very much again, it's more of a general management than the feeding. Older horses definitely can be more prone to respiratory problems. From my perspective, obviously, it's looking at the kind of forage and things like that, and utilising kind of forages that have lower amounts of respirable particles. One of the biggest problems that we have is with our bedding and also our forage kind of rations. Obviously, there's lots of different bedding available this time with lower levels of respirable particles. But when it comes to forage, the trouble with forage is when you look at a hay, you can't necessarily tell its quality or its mould count. Even hays that look kind of quite nice can still have quite a high level of respirable particles and kind of mould counts. Obviously, you can do things like steaming the hay. It's quite an effective method for reducing respirable mould counts, giving it a good dunk for at least 10 minutes kind of in the water, or utilising haylages, or even hay replacer products. So again, like the Dengie Senior or the Pure Grass, they all contain fibres that are precision dried. So it means that they undergo a drying process, which produces a very kind of clean forage. Have you got anything to add to that, Jenny, on the respiratory side of things?
The main management is, as you said, it's environmental management, and I'm actually was just quickly flicking through my emails because I have got a link to a video that a really lovely video that goes through environmental management, and I will try and post it on here now. If I put it on the chat, the link, hopefully, but also if anybody wants to find it, it's on our Facebook page. So it's mainly is keeping your environment as dust free as possible, really nicely ventilated. If you're feeding them any hay or feed, that it's soaked, because that is the main cause of COPD, or as we more likely call it now is equine asthma, is those dust particles that cause an allergic response within the airways. I would always recommend that you get a vet out as well, because in the very severe circumstances we need to use anti-inflammatories and airway dilators in them, and there's more we can do about management. But if I pop this link up, or if you look on our Penmellyn Equine Facebook page, you'll be able to find that video.
Lovely, that's great. There's a question here probably for me in the meantime. So I like this. Everyone likes a sweet treat. I think that's probably true. We all like a bit of chocolate. Even our horses. How many carrots and apples do you recommend? Or is there any good treats available? So they still have treats, but healthy treats. It depends what you're using them for. Kizzy certainly still has a little bit of carrot and apple in her life, but she'd only have kind of one a day, kind of really. So it's just sensible. So not by the bucket full, but kind of the odd bits is absolutely kind of fine. And we all like rewarding our equines and giving them a little treat. If you're talking about things like kind of forage balls or the treat balls, then you've just got to make sure that whatever's going in them is suitable for your individual and their weight and their calorie kind of requirements. We do things like the 𝗙𝗲𝗿𝗶𝗴𝗁 pellets and the kind of grass pellets that can go in the treat balls. So they'd be high fibre and low starch. So generally they would be considered healthy. But again, they're still not without their calories. So if you're feeding them to something that is a real good doer, I'd question the need for too many of those kind of in their life. But you can even use things like your balancer in your treat balls, as long as it doesn't get completely lost in the bed. Brilliant. There's one more on here, which isn't a question, but it's just a statement which I absolutely love, where somebody describes they have a dinosaur of their own. 48 years young, Welsh Section A. That's very impressive indeed. And who's on a hay replacer. She has no teeth, fed on grass pellets, and is kept to looking amazing for about 10 years. That's absolutely fantastic to hear. And certainly, you know, that they can live well into their old years with dental problems. But again, as long as they're fed something that they can actually manage to chew and keeps them nice and healthy. We work locally here with a sanctuary called 𝗙𝗲𝗁 Memorial Horse Sanctuary, who have a huge elderly horse population. And they had one that they believed that was in their 50s. So you're almost there with your dinosaur as well at 48 years young, but again, doing really well on soaked kind of fibre rations. Okay, I think that's all of the questions, Jenny.
Okie dokie.
Have you managed to pop your thing in the chat?
Yeah, it's on the chat, and if the link doesn't work, I've popped a couple of other places where it can be found as well.
Yeah. Oh, somebody was just asking if you'd be able to watch this session again. Yes. So those of you, anybody that's registered, will be sent a link to be able to watch. It was being recorded, so yeah, you can see that, just to pick up on that as well. But other than that, I think we are there. So thank you very much, Jenny, again, for your time and your perseverance with the technology. It was a huge subject and it was great content, so thank you. That's super. And obviously, if any of you need any help, you know where kind of Jenny or I are. We're certainly here for some advice. So thank you, everyone. And other than that, I shall say good night.
Yeah, thank you, everyone. Good night, and thank you for sticking with me. Take care.
Bye.
Bye.